So without further delay, here is Public Health Director, Dr. Raynard Washington. Dr. Washington.
Thanks, Bill, and good afternoon, everybody. Thank you all for joining us today for this virtual availability. It's been a while since we did one of these, but I do have a number of topics that I'd like to provide, mostly situational updates on, and some key points of guidance that I need your partnership on, and sharing with our residents. Some of what I'll review you may have already seen previously in some of the media releases that we've been sending out, but I did feel this would be a more efficient way to cover a number of topics. So I'll ask you guys to just bear with me. If you have questions as I'm talking, go ahead and write those down because I will cover quite a few topics this afternoon. Let me first start with respiratory viruses. Even though it doesn't feel like it outside, we are entering respiratory viral season. We are anticipating, as we have seen for the last several years, a combination of various respiratory viruses circulating in our community, and we are trying to be as prepared as possible. And that includes ensuring that our residents have information available, but also are able to use the tools we have available to us to help protect each other. On the COVID front specifically, I'll start there. As we have seen over the last several years, there was a summer surge that was occurring. And unfortunately, unlike last year, we're not seeing the declines in COVID activity yet. And so we would have, this time last year, things were starting to cool off a bit. But that's not happening currently based on wastewater surveillance, as well as what we're seeing in our hospitals. We are seeing COVID-like activity in our ERs, admissions, as well as unfortunately, we are seeing an increase in COVID-related deaths, which is partly why I'm starting here as a topic of discussion. As a reminder, if you're not speaking, please keep your microphone on mute, just because there is a recording on to make sure everybody catches the things I'm saying. Sounds like somebody's come off mute. All right, I think we're good. Okay, so as I mentioned or was saying, we are starting to see some unfortunate deaths as it relates to COVID or related to COVID. So I did want to ensure that individuals were aware that that was happening, and it's a good time given that the FDA and CDC also just both approved and recommended the COVID vaccines for this year. We don't yet have data specifically on deaths in Mecklenburg County. So because of changes in how we are reporting that information as a result of the public health emergency ending, we don't have county-specific data available just yet. But I do know anecdotally that there have been some deaths that have occurred, at least in the county, maybe not residents, but in the county. So I did want to take this opportunity to reinforce for our residents what they can be doing to protect themselves and their loved ones. As I'm sure you all know, I'm going to say first and most importantly is vaccination. With the new boosters becoming available, this still remains the most important tool we have in our toolbox, especially for reducing morbidity, mortality, and hospitalizations related to COVID. The boosters are starting to make their way into our community. We are anxiously awaiting our supply here at the Public Health Department. We don't have them yet. We have received the initial shipping notification. So I do expect that we'll be able to start offering vaccines in our clinics within the next 10 days. But we will keep folks posted. Probably we'll send out a press release as soon as the shipment comes so that people know how to make appointments and when they'll be available in our clinics. Again, I'm going to just remind folks to please keep yourselves on mute. I do hear some background noise coming from a microphone. Importantly, also related to COVID, things are going to look a little bit different for residents in terms of accessing vaccines. And this is really specific for uninsured adults. With the ending of the CDC's Bridge Access Program as a result of congressional budget rescissions, we are no longer receiving federal support to secure inventory of COVID vaccines for residents who don't have insurance. We are still receiving support that allows us to help cover the cost of administration, so our staffing cost, as well as any other ancillary cost associated with it. But the cost of the vaccine itself, we're not receiving any federal support or state support to cover those costs. So the burden, unfortunately, is now on us locally to be able to support that. So I'm very thankful to the leadership of our County Manager Diorio, as well as the Board of County Commissioners, who have made resources available to us to ensure that we are able to secure, though limited, a supply of vaccines for adults who don't have insurance. So we will be able to offer vaccines for uninsured adults here at the Health Department at no cost. And again, we don't have the supply yet, but once it's here, we will again get that information out to you guys to help share with residents residents so that our uninsured residents know where they can go to access vaccine. The good news is that that is the only group that should experience any differences in terms of access. Most kids will still have access to coverage through either their primary or private insurance, or if they're on Medicaid, Medicaid will cover it with no cost sharing, as well as we will receive a supply through the Vaccines for Children's program. Medicaid for adults, private payers for adults, as well as Medicare will also be covering it, and there shouldn't be any cost to the resident. So again, as I mentioned, we will be providing a written update when we have them here in the health department. I do know that some retail pharmacies do have already begun receiving supply and are offering appointments. In fact, my mom called me last night when she was getting hers at CVS. So I do know that some appointments are starting to trickle in across the country. And so I would encourage residents, especially those who have insurance, to go ahead and take advantage of those opportunities as they're coming available. And begin to take access to vaccines, especially now because we again are dealing with this sort of continual surge that we're experiencing and want to make sure people are protected. Beyond COVID, it's also time for flu season. Flu has also begun circulating, though at very low levels. So I also want to take a moment to encourage residents to also ensure that they are getting their flu vaccines. Again, we will also have flu shots here at the health department available for folks who don't have insurance, and specifically for those who are older adults, pregnant women, want to ensure that you all are getting access to flu vaccines as well. We will again have a supply here in public health as we have in previous years, and we will keep you guys posted as those appointments are available. Lastly, on respiratory viruses, as you guys have heard us talk about for the last couple of years, we are seeing expecting RSV activity, and unfortunately, it's starting a little sooner. And this particularly is occurring in our pediatric population. We're already seeing evidence of rising cases and activity in our healthcare systems related to RSV and young kids. And so as a result of that, we typically start administering RSV vaccines in October. But because of the activity that we're seeing now, we're going to start earlier this year. And in fact, that is going to be probably happening across the entire state, where we'll be offering RSV vaccines sooner. And it really is for, parents with kids who are under the age of 19 months really should talk to their provider about their options and their risk. But we will start administering RSV vaccines here at the health department by September 15th. And so we'll also make sure that the vaccine press release has all those details available for our residents. Switching subjects a little bit now to talk a little bit about childhood immunizations. More globally, we are continuing to see outbreaks of other vaccine preventable conditions in kids. As some of you may recall, we sent out an advisory probably several months ago about an increase in pertussis cases, also known as whooping cough, that we were seeing here in kids. We are still seeing activity, and I really need parents' help, particularly as kids are returning back to the classrooms this week across our county. And the most important thing is to make sure that kids are up to date on all of their vaccines. So we are offering vaccines here at the health department, of course. Take your kid to the pediatrician's office to make sure they're up to date. We can give us a call if you just need to check their records or make sure the records are good. We haven't had any outbreaks locally, as we've seen in other jurisdictions of other conditions like measles or mumps or polio. But I'm fearful, though, if we don't do the work to make sure folks are vaccinated, that we will start to see those at some point. These outbreaks are largely preventable. And so we really want to make sure that our kids are up to date. These vaccines are highly effective. We've been using them for decades. And these outbreaks are really showing now because of decisions or lack of access to vaccines. And so kids are not being up to date on those. You all should have received a release last week about our upcoming Big Shots events, or maybe earlier this week, that will be held next Saturday at the Ella B. Scarborough Community Resource Center. That's Saturday, September the 7th. There we will be offering all childhood immunizations. And fortunately, our partners at Atrium Health will also be on site with their clinician staff to provide physical assessments as well. We're trying to avoid having as many kids on that exclusion list in September from our public schools. So we want to make sure we have a one-stop shop for parents to get their kids both up to date on vaccines and also other requirements needed for school. We made space for about 500 appointments, and unfortunately, all of those appointments are full, and so we have shifted to an online wait list. You can list yourself online on the wait list, and so if we have a cancellation, we will be able to call you and get you scheduled. We also do have capacity to serve walk-ins, so we will be taking walk-ins. But I do ask families to prepare to be patient, as it does take quite a bit of time to verify vaccine records and prepare doses for every specific kid. And so there again, there's a wait list online. You can sign up. If you made an appointment and you won't be able to make it next Saturday, please give us a call to cancel so that we can give that spot to a family that's on the wait list. I will be available at some point next Saturday as well to take questions from the media. If you come on site, I do ask you and your teams to avoid recording any of our patients and their families just for confidentiality. All right, switching subjects again, moving to Mpox. I just want to talk for a minute because since the last time I've spoken to you guys, WHO did declare Mpox a public health emergency of international concern. Right now, I want to start with saying that the risk remains relatively low to the general public in our community. We don't have any cases that we know of yet of the Clade 1 variant, which is the one of concern that's currently circulating in the Democratic Republic of Congo and surrounding countries. But we are starting to begin more intense monitoring of anyone that's been exposed. And of course, the state and CDC partners are doing additional molecular surveillance so that we are aware if, in fact, a case of this variant comes into the country. I'm advising residents to take caution when traveling to those regions. It's not a travel advisory. I'm not issuing that, nor has the CDC, but I do want people to take precautions. So if you're traveling to the DRC or any of the neighboring nations that where this strain of Mpox is circulating, I would advise individuals to consider vaccination, of course, which we still have available here at the health department. Also to avoid contact with anyone who has Mpox. Also avoid any unnecessary close physical contact. And of course, most importantly, as most of our cases have been transmitted via sex, to not engage in unsafe sexual practices. As well as if you've been exposed or think you've been exposed, just give us a call so that we can start monitoring as well as for symptoms. Shifting gears from Mpox now to congenital syphilis, I just have a couple more topics to cover, and then I'll be happy to take whatever questions. I know I'm going through this pretty fast, so I'm happy to talk more about anything that I've covered quickly. As you all know, we have been for the last 5 to 6 years really combating the issue of congenital syphilis that's been emerging here locally across the state and across the country. We are continuing our efforts. Our internal task force continues to work to address congenital syphilis. We are conducting case reviews as for every case of congenital syphilis, which of course is preventable. So I need you all's help as well in this work and partnership to really help our residents and patients, and particularly pregnant women, be advocates for themselves as it relates to syphilis. And so we need pregnant women to ensure they're being tested for syphilis. So if you are pregnant, my message to you is to ensure that you've been tested, and not just tested once, but tested throughout your pregnancy to ensure, especially if you continue to be sexually active while you're pregnant, to ensure that you have not been exposed to syphilis and avoid that vertical transmission to your the unborn baby. There are really three scenarios where congenital syphilis emerges. In cases where pregnant women are not tested in the state of North Carolina, it's actually required by law that pregnant women are tested for syphilis. And so we want to make sure all of our providers are testing and know that they have to test and when they should be testing. Also in some cases where people are tested and not treated, either because they are lost to follow-up or because the provider does not reach them for treatment for some reason, the healthcare provider. And the last case, which we are seeing more commonly, is that individuals have been tested, treated, but not treated properly, which is resulting in vertical transmission of the infection to the unborn child. And so we are doing significant work. As you all know, 2 years ago, we hosted the first syphilis summit here. It's the only one in the state. We were scheduled to have the second, which is really an opportunity for us to educate providers on appropriate testing and treatment of syphilis and management of syphilis. We were supposed to have the second one a couple weeks ago, but the hurricane got in the way. It has been since rescheduled. And we do have just a few more slots available for that. So I encourage any healthcare provider, physicians, particularly OBs, to register and attend, where we will have experts from across the state and country here to help to make sure our providers are equipped and prepared to deal with syphilis and help us in our work to be able to eradicate congenital syphilis in the community. And so we are continuing that work. We had uh, in 2022, I think, excuse me, I got a pre-question about this. In 2021, I'll start there. There were 8 cases of congenital syphilis. There were 12 in 22, and there were 13 in 23. So the growth is slowed a little bit, but there's still way too many. It's absolutely preventable, and we need the entire community's help and support in getting congenital syphilis under control, and making sure that all of our pregnant women are getting tested and treated properly. We are launching as well a congenital syphilis campaign again, just to make sure that women are aware, and need you guys' partnership in helping us get that message out to the community. Lastly, last topic for today, and again, I'm happy to take questions about any of the topics I've discussed, is West Nile virus. We are starting to see some activity. We have at least 1 confirmed case and 2 suspected cases of West Nile virus. And so we want to make sure that we encourage residents to take steps as it relates to mosquito safety, especially this weekend, going into the holiday weekend, and folks will be out barbecuing and on the lake, encouraging people to just make sure you're wearing bug repellent, and that you're taking caution if you have bug bites, and if you start to experience any symptoms, fevers, or additional rashes, that you get checked out. And so just making sure that people are watching very closely, and taking those precautions this weekend while they're out enjoying the rest of the summer and this unseasonably hot weather we have here at the end of August. So with that, I'm going to take a quick swig of water and open the floor for questions.
Floor is open for questions. Please identify yourself and your media outlet. Floor is now open for questions.
David Hodges, WBTV, if y'all don't mind me jumping in here. You mentioned a lot about congenital syphilis here. And with the numbers, I think you said 8 and then 12 and then 13, so not necessarily decreasing. Is there anything that could be done to make sure the testing, the treatment is actually being completed? Should providers be held accountable if they're not doing that?
Yeah, and so we're working closely with thanks for the question, David. We're working closely with the state to look at what additional steps we're taking. We have been in close contact with both of our healthcare systems and their provider networks. We are planning to do additional grand rounds in the systems, not just the Syphilis Summit, to have our team out and available to be able to provide education. We also have care managers who sit in the OB practices, and so are working with them to be champions for us as well, and make sure that they're able to provide that kind of advocacy in that setting to ensure that every woman's being tested. And then again, we're doing direct follow-up with providers. So every congenital syphilis case, there is a case review that's done in partnership with the state and our team. And so we are contacting directly providers to ensure that they are educated following any incidents, to make sure that that's happening, as well as our DIS team. Again, as they do their work every day, they are such heroes. We are the only county that has a DIS team, and they work really, really hard, not just on congenital syphilis, but also on syphilis, to make sure that they are in touch with those practices, to make sure when there is a positive lab that comes in, that they're working very quickly and diligently to get in contact with that patient. But we also need the community's help, David. The reality is that we need folks to answer our calls. We need folks to answer the calls of their healthcare providers when they call. And really help us in that work to make sure that we're able to follow up and treat properly, and make sure that we can disrupt the transmission that may be occurring in the community. Our DIS work really hard. Their job is really to make sure that we find out if somebody has a condition, who they may have infected, and where they may have gotten that infection from. And so they are working every day to do that. But the landscape is changing. Our sexual behaviors are changing. There's more anonymous sex that's occurring in the community, and that is making our work more difficult, really. It makes it more difficult for us to try to disrupt those chains of transmission as it relates to not just syphilis, but also HIV and gonorrhea and chlamydia as well. We are seeing some progress on some of those, but again, it's still way too high, and it's still an opportunity for us to continue to get our residents to help us. We can't police people's bedrooms, but we do work to make sure that we provide education, resources, and really take a harm reduction approach by being able to offer testing and other resources in the community. And if folks need to know how to get tested, first off, any pregnant woman who needs the syphilis test can call the health department and we'll get them in immediately to be tested. We also have for the general public at-home testing for at-home test kits. You can order them on the county's website. They will be sent to your home and you're able to do the collection at home and get the results at home as well. And so we're doing everything possible. Of course, you guys know our mobile units have been out in the streets and really working to make sure. We did a lot of testing a couple weekends ago at Pride as well on the mobile units. And so that effort continues. You didn't ask all that, but sorry, I rambled a bit.
I appreciate it. Thank you.
Sure. Next up?
Next question is Stephanie Escobar.
Hey, this is Stephanie Escobar from Spectrum. I had a couple questions. I wanted to confirm that the COVID-related death you were mentioning happened in Mecklenburg County.
Stephanie, there has been a death in the county, but I don't have enough details to be able to actually provide you any real insights. And so I think the top line message there is that deaths are increasing across the state. And that deaths are increasing across the country. And so it is important that people take precautions and take advantage of the tools that we have available to us, specifically the vaccines. And I meant to say earlier, it's also really important that people stay home if they're sick. As we go into respiratory virus season, I know it's warm outside, but if you don't feel well, if you have a fever, you have a cough, it's best to stay away from others until those symptoms resolve. There's a lot of COVID being transmitted right now. I think anybody on this call probably knows somebody that's had COVID recently. I know several people, and so the reality is we need to be taking precautions. And folks who are more immunocompromised or more vulnerable, or folks who want to just take extra steps, I say wear a mask and keep one nearby, especially if you're in crowded settings. Because it is going around, flu's going around, RSV is going around, and we need to take our efforts to protect those who are most vulnerable.
My other question was, will the supply for COVID-19 free vaccines that you secure through the county, would they be enough to cover people without insurance? And if not, what are their options?
It's a great question. I don't know. We are doing quite a bit of advocacy to not just our state partners, but mostly our federal partners to help us in this. The CDC did announce earlier this week that they are going to be releasing additional $62 million that they suggested would be able to help with COVID vaccine cost. It's unclear if that will actually be available to us at the local level. It's also unclear if it'll be available to us to actually purchase vaccines. So we have COVID funding that we have remaining in the county, but we can't use those funds to purchase vaccines. And so we're having to use local resources to actually purchase them, which are to the tune of $120 to $140 per dose, which is a really expensive vaccine. At the moment, we don't know. I don't know what the demand is going to be. And so it's something that we're going to be watching really, really closely here at the health department to ensure that we can offer as much vaccine. I don't know yet if any of our other healthcare providers will be making investments in the community. I certainly welcome it. Anyone who wants to help out in this, making these available at either a deeply discounted rate or free for residents who don't have insurance. And even that goes for our retail pharmacies too. Anybody that wants to help in that work, I think we would all welcome it, not just here in Mecklenburg, but across the state. Because we're fortunate, and again, I appreciate County Manager DiOrio for her leadership and giving us resources to be able to acquire some locally, but that's not the story in every county. And so we are working towards making as much available as we can. It will be limited, and we'll let you guys know when we have it on hand and available for people.
Next question, please. Last call for questions.
Hello. Yes. Hi, this is
Go ahead, Eli.
Eli Portillo, WFAE. We've heard a lot nationally about lower vaccine booster uptake for COVID and people kind of just, being blasé and thinking, it's endemic, it's over. What are you going to do, and what would you say to people to encourage them to actually take the steps to get the booster and not just not just have that kind of blasé attitude.
Yeah, I mean, part of me, this conversation today is to let our residents know. It looks like I'm freezing a bit.
I still hear you.
Okay, all right. Part of this discussion today is really our efforts to make sure our residents know that transmission is continuing to be high, as well as what's going on, right? People are in the hospital and COVID is not gone. It's still here. It's with us. We've been saying that for years. And so the risk is still there. And so it's important for people to take precautions. We are continuing our grassroots community-based efforts, both in terms of our mobilization of vaccines on the ground. We've been doing that up until this point. Of course, now we're not doing that because we're waiting for the new booster. We also are still doing education campaigns, as well as providing additional resources to partners who will help us be able to get the word out. And so those activities all continue to make sure people know that COVID is still here. Again, this is an opportunity for me to get in front of a lot of people and say that very thing, that I encourage folks to get vaccinated, get boosted, because we are seeing a lot of activity and want to make sure that we do everything possible to lessen the burden on our residents in terms of their health and well-being, as well as the systems that have to care for them.
Thank you.
Sure.
Next question, please. Last call for questions.
Stephanie Escobar here with Spectrum News. Can I ask
ahead.
another question?
Go ahead, Stephanie.
In terms of what we were talking about, the Bridge Access Program ending, are you concerned specifically about any communities that may be impacted more by this program ending?
Sure. Well, I think the groups that you think about are folks who don't have insurance. So we know in Mecklenburg we have roughly 100,000 adults without healthcare insurance. And so those individuals are those that I think are at greatest risk. That group of folks are people more likely to be foreign-born residents, Hispanic residents. That group of folks are more likely to be in the lower income bracket and more likely to be male as well. And so off the top of my head, those are the groups that are more likely to be disproportionately impacted because of their lack of insurance coverage. But I will say, just a plug here for Medicaid expansion and the importance of folks checking their eligibility, not to overwhelm my colleagues in the Department of Community Resources, but we do want to make sure that every resident who has now expanded access to Medicaid is enrolled, and that's really important. We do know from the state data that's been reported that uptake in Mecklenburg is going well, but we want to make sure that no resident is missed. Our department and our healthcare providers are all checking and making sure residents are looking, making sure that we check their eligibility for Medicaid to ensure that if you are eligible, you're getting enrolled so that that barrier can be removed to you accessing healthcare.
All right, David.
I have just
Go ahead, David.
Quick kind of overarching question, maybe a little theme here I could get you to weigh in on. You mentioned for the Big Shot event that's coming up that y'all are totally signed up, which is fantastic and good to hear. There will be walk-ups. You also mentioned that because of some funding changes, that COVID vaccines for uninsured are going to be done a little differently. Is funding an issue, and do you have any message for elected leaders in Washington to make sure local health departments are getting the necessary resources to combat all of the things that you listed here?
Yeah, David, I got a lot of messages for the folks in Washington, but yes. And we've been doing a lot of advocacy here locally through our associations, as well as Big Cities Health Coalition, to get that very message out. Public health departments are on the front lines of dealing with a lot of really complicated public health challenges, as I've listed just a few of them today. I didn't even get into rabies and feral cats in this conversation, but I can. But there are a number of topics that are continuing to challenge us. Our agency is having to use the same resources that we have on hand to be able to respond to them as they all grow and escalate. And I think the top line message is we have to invest in the core infrastructure of our public health system in this country, both locally at the state level and the federal level. We cannot continue to do what we have been doing, which is this sort of boom and bust funding. When there's a big problem, we put a lot of money into it. It's a big news story. And then when people think it's not a problem anymore, the money goes away, which is what we see happening here with COVID. And we're not prepared. So when emerging infections like Mpox come, if all the funding that I receive from the state and federal partners are tied to a specific healthcare condition, then I don't have the resources there to flex because those funding streams are tied to a condition. So we really have to also think differently about disease-specific funding and fund the infrastructure, the core infrastructure. I'm very fortunate that the CDC has made a very positive step in that direction with our public health infrastructure funding. It gives us an opportunity to be able to actually have some core readiness to deal with all these issues at the same time. People often ask me what's my top issue as health director. I don't have one because we have to deal with all of these all at the same time. And so as we think about funding, both from our federal partners and specific, we got to invest in the public health system. That's where we prevent the downstream cost on the healthcare side. We invest trillions and billions of dollars in healthcare, and only a fraction of that, very small fraction in public health and prevention. And as a country, we've got to think differently about how we do that. And so that's my sort of top line message to folks as it relates to our funding. I also am going to just continue to say that we're very blessed here and fortunate in Mecklenburg County. County Manager Iorio and her executive team, as well as the Board of County Commissioners, continues to prioritize investments in the public health department and the work that we're doing in the community. And so I'm not asking for funding right in this conversation. I think that's a broader message for the community and the broader sort of elected officials. But our Board of County Commissioners and the county manager are committed, have made significant investments, and we are very fortunate for those. And that's what allows us to get our work done, really.
Next question, please. Last call for questions. Anyone else? All right, thank you, Dr. Washington. For those of you who would go ahead.
I was just going to say thank you all. I appreciate you all being here today.
Thank you, sir. For those of you who'd like to view a recording of this virtual media availability, we're going to upload it to the Mecklenburg County YouTube site shortly. If you have any issues finding that, please reach out to your public information officer and we'll get you the link. Everybody be safe.